Assalamu alaikum guys. Today we'll be discussing about the enlarged prostate effect on the bladder. यानी जब हमारा जो प्रोस्टेट जो है वो उसके साइज जो है वो इंक्रीज हो जाता है तो उसका ब्लैडर के ऊपर क्या इफेक्ट होता है. So the symptoms of the benign prostate enlargement, if the prostate become enlarged, it can place pressure on the bladder and the urethra, which is the tube that passes the urine through it, and this can affect how you pee and may cause difficulty in pee and a frequent need of the pee. So, uh, can enlarged prostate cause bladder problems? Yes, an enlarged prostate can cause symptoms that may bother you, such as blocking the flow of the urine, and it can also cause the flow of the urine, and it also cause bladder, urinary tract, and the kidney problems. So, if we see just what is prostate and how it gets enlarged, so these are the urinary bladder where the urine is stored, and the urinary tract and the reproductive system of the males is connected by this. So the prostate is the gland of the reproductive system, and it gets enlarged. And this is the other part of the. So these are the bladder, and right behind below the bladder there is a prostate gland. So in the prostate or the benign prostate or the prostate gland hyperplasia condition, what happened? The prostate enlarged. The size of the prostate get enlarged, and this is called as benign prostatic hyperplasia. So, in the benign prostate hyperplasia, there's the large prostate affect the bladder. Yes, it what is cause it causes difficulty in the urination, and it causes multiple bladder, urinary tract, or kidney related problem. It can cause infection, it can cause pain, it can cause uh, uh, y- uh, uh, a urine problem like no urine or drop effect of the urine might mean like the patient have the uncontrolled pee effect or uncontrolled urination, and the patient is unable to control the condition of that, and that is very embarrassing condition. So this is the small pictorial representation of the benign prostate hyperplasia, BPH as known. So this is the normal prostate. As you can see, the prostate is very normal in the size. It has no effect on the urethra, and the flow of the urine from the bladder to the through the urethra is very normal, and the flow is normal. It has enough path to follow the urine from bladder to the urethra, and finally to urinate it. But in the condition of the enlarged prostate gland, what happens? The size of this prostate glands get larger and larger. Because of that, it exerts pressure on the walls of the urethra, and because of that urine does not pass normally through this passage, and the process of urination is either blocked, or small droplets of the urine might get placed in the patient, and it is very embarrassing for the patient. So this is the fact of the prostate or the prostate cancer or the prostate enlargement or the prostate hyperplasia on the patient. So prostate enlargement or the benign prostate hyperplasia is a condition in which the size of the prostate gland that is just below the bladder and press the and it press the urethra, and it stop the passage of the urine through it. So if we generally defined the prostate hyperplasia, so it is a condition, and enlarged prostate means the gland has grown bigger. The prostate enlargement happens to almost all men as they get older. An enlarged prostate is often called benign prostatic hyperplasia, BPH. It is not a cancer, and it does not raise your risk of prostate cancer. Is it serious? It is a medical term describing enlarging in the prostate, a condition that affects how you pee or urinate. BPE is a common in men over the age of 50. It is not a cancer. It is usually a serious threat to the health. It can cause uncontrolled urination, and it can cause multiple kidney and the urinary bladder or the urinary tract and complications. So, can an enlarged prostate can cause urinary loss of the bladder? Yes. So can an enlarged prostate? Yes. Some men with an enlarged prostate gland, benign prostatic hyperplasia, eventually start to experience urinary inconsistency, the involuntary discharge of the urine or the blockage of the passage of the urine. The inconsistency can be related to overactive bladder, or one of the changes of the bladder function can cause BPH. So can enlarged prostate can cause bladder retention. In a small percentage of the man, an untreated BPH can also cause urinary retention, meaning that the man is unable to empty the bladder. The risk of the urinary retention increases with the age as the symptoms get worsen. And an enlarged or inflamed prostate can apply a pressure, and it can also irritate the bladder and causing the bladder wall to become thicker and irritant. The irritation can cause the bladder to contract even when it contained only a small amount of the urine, causing more frequent urination and the drop of the urine effect. The urinary inconsistent is also related to prostatic problem. As man age, the prostate gland grows in the larger. It can also squeeze the urethra and push the neck of the bladder out of the position, and that changes lead to the inconsistent. As you can see in the picture, in the normal prostate, the passage of the urethra is very normal, but in the condition of the prostate, the prostate, the enlarged prostate is pushing pressure on the walls of the urethra, it causing the inconsistent in the urinary. So what are the latest treatment for the enlarged prostate? So as far as the treatment for the enlarged prostate is concerned, the treatment for an enlarged prostate may help reduce prostate size or reduce the symptoms. Treatment include water vapor thermal therapy, prostatic urethral lift, and prostate artery embolization. And the most successful is TURP is the most effective treatment for the prostate. However, in adult or of 65 or older, medication and minimally invasive treatment are preferable. Older patient may have complications on the from the recovery of from the surgery. The transurethral resection of the prostate (TURP) involves removing part of the prostate gland using a device called uh, a resectoscope that passed through the urethra, the tubes through which the urine passes out of the body. It is suitable for men who have enlarged prostate, and the surgery is not commonly suggested in the older patient who have the age above 65. Um, it can be it is difficult to treat this condition permanently, but completely reverse the enlarged prostate is very difficult. There are several treatments that relieve the symptoms and reduce the size of the prostate and help restore normal urine flow. In fact, many men with prostate enlargement are able to achieve a positive quality of life with non-complicated treatment. And for the most of the patient with the enlarged prostate, there is a significant reduction of the symptoms with medication alone. And with the surgery, it can be give enough relief as a treatment effect. So, 5 alpha reductase inhibitors are the drugs. These are used for the condition. These medications shrinking the prostate, and they do this by preventing hormone changes that cause the prostate to grow. An example of this including finasteride, the brand is like Proscar, and the Avodart, and the generic it's dutasteride. They might take the 6 months to work on the wall and cause the sexual side effect. Means they will shrink the size of the prostate. And mostly for the surgery, the size of the prostate should be larger than the 80 ml to perform the surgery, and the medication is also available. So if we talk about the curement of through the surgery, so it is very well treated through the surgery also. So these were all about the prostate gland. I hope this lecture would be quite informative for you, and you got proper known about the how the prostate affects the bladder and how it can be treated, and this lecture would be quite informative for you. Thank you so much for listening and for your time. Thank you so much. Subscribe to my channel, Akshi Pharmacist Mariam, and share this video to your circle. And if you have any query, you can ask in the comment section. Thank you so much. Allah Hafiz.